I want to make sure I have this right. The most rewarding procedure for you is like breast reconstruction.
Yes.
Elaborate on that.
Through the process of cancer, women are losing a lot. Some women have to go through chemotherapy, radiation therapy. They're losing their breasts. So if I can give them back something, a breast is something that women identify as being a woman, and giving them back that self-esteem is the most rewarding thing I've ever done.
Okay, so a woman's had a mastectomy.
Mm-hmm.
And so this is your favorite. Do you think you have a knack for it, for making it look natural, things like that?
Yeah.
And what do you do to create the nipple area?
Some women, there's an increasing trend in doing what's called nipple-sparing mastectomies, where you can actually save the nipple. If we can't save the nipple, then you recreate it with a flap on the breast, and then I use a skin graft from the areola. So the after results, occasionally women actually look better after their breast reconstruction than they did beforehand. Yeah, if they had long, droopy breasts, then afterwards they're going to have perky, higher breasts, so they actually look better. But it's not a good way to have to have it.
Is there a fear, though, after a mastectomy that the patient doesn't want to do any operation on that breast again because it may compromise their immune system, make the cancer come back? Is there any truth to that?
No.
Okay.
No. People used to have a fear of breast implants, but there's never been any proven studies showing that it contributes to autoimmune diseases or cancer or anything else. They're safe. Silicone gel implants are safe, and that's what's most typically used for breast reconstruction. Occasionally there's also flaps from your belly or your back that are used in breast reconstruction, but I would say the most common procedure that I do for breast reconstruction is implant-based.
What about a lean woman that is trying to do this after mastectomy?
Uh-huh.
How do you do it? Do you have to
you put a tissue expander in first, so it looks similar to an implant, except for it has a port in there that you're allowed to put fluid through, and so you expand that first. Women can be involved in the decision of how large they want to be.
Like a month prior to the surgery itself?
You do it at the time of mastectomy. So at the time of mastectomy, the breast is removed, tissue expander is placed under the muscle. Then they come into the office for several weeks to months after surgery, and you slowly fill that breast. So that it requires a second operation to remove the tissue expander and then put an implant back in.
Okay. Now, who normally does nationwide the reconstruction of the breast for these women that have had cancer, mastectomies? Is it normally the plastic surgeon? Is it
the plastic surgeon?
But is it more so the medical person that works at the hospital, or because you're like a cosmetic plastic surgeon?
I do both.
Okay.
So some plastic surgeons choose only to do cosmetic surgery.
Okay.
There is a big portion of my practice that's also breast reconstruction. I don't do a lot of other reconstructive type procedures. I do some skin cancer reconstruction, but the main reconstructive portion of my practice is the breast reconstruction.
It's and it's a tough time. So how soon after the mastectomy can they do this?
The tissue expander is put in conjunction at the same time of the mastectomy. So then about 3 months later, the tissue expander is removed and the implants put in. That's on average.
So how soon after a mastectomy should they see you or get a consult?
They should see me before they have surgery. So at the time that they're diagnosed with cancer, the breast surgeon refers them to me as well. So we plan this all together. Breast reconstruction is started at the same time as the mastectomy. So the general surgeon comes in, does the mastectomy, then I come in and put a tissue expander underneath the muscle, and we start the breast reconstruction that day. They follow up in the office for several months getting expansions. So there's an initial amount of fluid put in the expander at the time of surgery, and then it gets bigger as we go. Once we've achieved full expansion, at about 3 months they have their second surgery, which is the removal of the tissue expander, placement of a silicone gel implant.
How do you get your referrals for those?
That's from the general surgeon. I have several referring physicians that send them to me, and that's also been from word of mouth. Patients are really happy with their reconstructive results, so then the general surgeons hear about it, so I have more referring to me.